Hello friends, I am Dr. Imran and welcome my channel Technical Dentist. Today I am going to talk related a calculus stuck in teeth, which is a type of tartar. The patient who have come to us have a lot of calculus accumulated in the teeth, and today we are going to remove the through a scaler. So friends, we'll be removing it with this scaler. You can see how this calculus removed from the teeth may go with the help of this scaler. We will explain more about it our Madam Mary. Madam Mary, please explain this.
Hi everyone, my name is Whitney, hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's watch a teeth cleaning at the dentist on a patient with heavy plaque and tartar buildup.
So this is what dental professionals like to call a calculus bridge. Calculus is another name for tartar. As you can see here, to safely and effectively remove it from your teeth and from below your gums, you need a dental professional to scale it off for you. Okay, so what we've been seeing here, the scaler that is being used is called an ultrasonic scaler. It uses a combination of high pressurized water and ultrasonic vibrations to remove tartar and plaque and stain from the tooth surface. It's super gentle on the teeth, and it's extremely effective at cleaning around and below the gums as well. It's like a water lavage, spraying away bacteria from all the little nooks and crevices between the teeth and around the gums. I love it. Sorry, I'm just staring at it. It's so satisfying. A lot of patients usually ask me, that's a good question. They always ask me, do you have to use the regular scalers after, the scrapers? And the answer is generally yes. For the most thorough cleaning, the clinician will use both this ultrasonic scaler and the regular hand instruments scalers. Here we go. Okay, so you can really see this calculus here. And another big question patients ask me about this buildup when they see it on their teeth is, how did it get there? And the answer is simply from poor home care, not keeping them clean enough. So proper brushing techniques and proper flossing techniques, or water flossing or interdental brushes, are critical in preventing this plaque turning into tartar on your teeth. So if you haven't had a professional teeth cleaning in a while, this is your sign to get back onto your routine cleanings so the buildup doesn't sit on your gums like you see it here. The longer it sits on your gums, the more likely it is for you to lose bone. Bone is what holds your teeth in place, so you do not want to lose that bone, because then your teeth can get loose and they can fall out. And I know that's extremely dramatic, but it's true. So please brush, floss, and see your dentist and dental hygienist regularly to keep your mouth healthy.